Skin and hormones. Yes, I think it is one of the most common issues faced by women generally during the menarche, starting of the menstrual cycle, or even sort of the teenage time to even in adult onset also. There could be one of the major issues that can affect is acne. Acne, even though it's a single name, it's sort of like a like sort of more related to superficial symptoms. Ayurveda understand it as an external manifestation of a more deeper imbalance. So it's considered to be a very important situation where if we treat and take precautions, it can prevent any further issues related to hormones. It can act as a good indicator whether our overall hormonal health is in good shape. Um, there are various types, so I'm not going to go into sort of types of acne on the basis of how it appears, like cyst or papules, pustules, blackheads, whiteheads, etc. I'm going to look at acne as sort of what immediately causes it, especially in adult onset acne. In teenage acne, the most common cause is very well known is the hormonal changes related to the puberty, which causes an excess sebaceous gland secretion. So more sebum and oils are secreted when there is reason enough to clog those channels of sebum. Then they actually become sort of clogged, and that forms acne, or it can again go into further inflammation and be an inflamed acne. But I think it's important to understand that again we can see the dosha influence there, especially in say in adult onset acne. One of the triggering factors sometimes which we see in adult onset acne is change in routine and stress. Stress factors can trigger it. Even though we are talking about hormones, the effect of hormones directly on the acne, before that, stress can have an influence on how our hormonal system behaves. And that kind of acne usually comes in sort of waves, and it's always sort of characterized by being painful as well. And there could be other signs of dryness and dehydration. There could be digestive symptoms associated with it, like constipation or bloatedness. There could be factors related to like mind and emotions, where there is lack of focus, or all the symptoms which we would consider as vata aggravated symptom. And that's a vata predominant acne. When pitta predominant acne, like I said, is more sort of common during the pitta, and kapha predominant acne are more predominant during the teenage phase, but it can also happen during, say, the luteal phase, sort of the end phase before the menstrual cycle. The menstruation happens in the adult menstruation cycle, and that usually is of more inflammation, characterized by inflammation. There will be tendency for say redness, burning sensation. There could be other signs of pitta aggravation, like acidity or digestive symptoms, again related to more heat and acidic changes. There could be also factors related to the menstrual cycle, which might actually change or be irregular when the acne type is related to pitta imbalance. Kapha imbalance usually is kapha is that oily, heavy nature. If you remember when I spoke about the water and earth, it's more oily and heavy in nature. So kapha related acne usually is associated with there would be sort of obvious excess sebum secretion, oily skin, but along with that there will be other factors that's noticeable, like fluctuating weight or water retention, heaviness in the body. There could be sort of say marked lethargy or tiredness, signs of almost a classic low metabolism, low sort of thyroid kind of symptom. It doesn't have to go into hypothyroid, but there could be symptoms of lower metabolic rate, say lack of energy, This can be also associated with a constant weight gain or a fluctuating sort of weight. So depending on the associated symptoms, we actually move from seeing acne as one particular illness and trying to sort of treat it symptomatically to understanding what are the other underlying symptoms and how these are connected. Sort of, instead of super specializing into the symptom, sort of super generalize what's happening in the body and try and treat that dosha imbalance, whether if it's related to vata and there are symptoms of vata imbalance like bloatedness, constipation. We would sort of address that factor first, try and sort of help with the cleansing process so that there is not too much of toxins reabsorbed and accumulated in the body, causing the acne to manifest. We try to sort of adjust the routine of the person, which is very important when we talk about PMS as well. In Pitta sort of acne, the focus will be on reducing that acidic nature in the body. So the diet recommended can be sort of similar to say an alkaline sort of diet, but then it's not exactly based on the pH level. It's more based on Ayurvedic concept of whether a food is warming or cooling by effect of it. Once it is digested, certain food actually make us feel warm once we consume it. Say for example, red meat or any preparations made of say vinegar. Those things actually make us feel warm once we consume it, and sort of normally consumed in sort of winter time as well. And those kinds of food will be suggested to be avoided, and there could be sort of things, herbs which are cooling in nature, like for example, the most common and easily available one would be aloe vera or aloe plant. Aloe is quite cooling and balancing. The Sanskrit name for aloe is Kumari. Kumari is sort of like a, in Sanskrit means like a young woman's friend, mainly because of its multiple benefits in terms of hormonal balancing, its ability to help with hair growth, its ability to help with skin related issues, dryness, moisturizing effect, all of that together. It's considered to be one of the best friend for women, and many sort of issues related to hormonal imbalance as well. Kaphaja ones, the ones which are related to oiliness, heaviness, water retention, all the physical symptoms related to water and earth imbalance. The remedies will be more focused on trying to get the diet a bit more sort of varied, less focused on sweet, sour, salty kind of diet, which we always have. Less of grains, try and sort of reduce the dairy content, which is usually quite kapha increasing, can increase mucousy nature and oiliness. It's not against oils completely, but sort of dairy products might be not ideal, best to reduce in kapha type of acne. It's also important to sort of get into some form of cleansing routine or fasting routine. Doesn't have to be like one full day of fast, but possibly like a intermittent fasting, or doing a mono diet where you are doing just khichdi, or khichdi is like a rice and lentil kind of brothy, like a porridgey kind of preparation, or any sort of simple soupy preparation for one day, giving rest to the system and enough opportunity to pacify kapha and cleanse as well. So from acne, if we think about another factor which usually creates mostly affect women is PMS, and premenstrual syndrome or premenstrual disease involves health issues that are mostly concerned with the hormonal changes just before the menstrual cycle, and can be sort of having both physical as well as mind and emotions related symptoms. It can create sort of dehydration and constipation, bloatedness, that kind of physical symptom. Breast tenderness can be there. But along with that, most women also experience tiredness, lack of energy, and sort of more vata predominant symptoms. And that's very important because PMS is sort of body's, in fact, a sign that body doesn't actually have the same capability physically, or body goes through different stages, especially in a hormonal cycle, where the ability to rest and recover is varied. And in certain stages, body will actually enforce it by saying that there needs to be a bit more rest than what you are normally getting, because of the kind of changes that's happening during that phase in the hormonal system and the whole reproductive system. So PMS mostly is considered as a vata imbalance state. So the treatment, in fact, more than the diet, more than any particular herbs, I think PMS needs two things. One is proper rest, and another one is equally important, is proper routine. It's very counterproductive for vata imbalance to have a routine which is not well set and based on how you feel and how you feel at that time. So there should be enough sort of focus given on opportunities to rest, opportunities to relax during the day, while continuing with the normal work and routine. I think more than if it goes into other symptoms related to, say, mental symptoms like or emotional symptoms like depression or increase in anxiety symptoms, then that needs to be approached differently based on the intensity of vata. But I think if we are talking generally in any women healthy and focused on maintaining good health, I would say rest and a good routine is the most important factor which would be helping with PMS. I think the most important thing to avoid will be any form of change in routine in terms of sleep. It's very important to avoid any sugary or highly stimulating food and drinks like say alcohol or caffeinated drinks, which will always give it will be a natural thing to go to caffeinated drinks, but whatever benefit that it gives in terms of energy levels will be lost quite quickly, and it's not easily sustainable. So it's important to sort of acknowledge the fact that some amount of extra rest is required during that phase. Natural remedies other than what we mentioned about diet, rest, and routine, there are specific herbs which, especially in the case of hormone imbalance related acne, what we normally also observe is that there are factors related to accumulation of toxins and accumulation of blood impurities, which we call in Ayurveda as rakta dosha. Blood impurities do accumulate in longer time due to hormonal variations or hormone mimicking chemicals unfortunately present in our environment and the things we use. So it's important to actually address that factors using some form of cleansing herbs. The most common, I think, two herbs which will be really helpful in sort of cleansing the system, clearing up the blood impurities one will be neem. Neem is quite commonly, I think, available worldwide. It's a bitter herb. The Latin name is Azardiracta indica. It's considered to be quite pitta balancing, and at the same time it's also a blood purifier. Similarly, blood purifying effect is also seen in Mangishta. Mangishta is rubia cordifoliates. Rubia name comes from the redness in the red pigments present in the plant, and it's I think traditionally has been used in cosmetics, I think thousands of years ago. And I think it's also used in coloring a natural fiber as well. But traditionally in Ayurveda, it's again also a pitta balancing herb, and it's also a rakta shodhana or blood cleansing, blood purifying capabilities, which helps with the acne and any imbalance related to blood impurities and pitta imbalances causing the acne symptoms or any skin related symptoms associated with the hormonal cycle. So it's manjishta and neem.